Hello, Malaysia, and welcome to the 17th episode of Censored Science, a community education project powered by Pusat Perubatan Naluri and carried live on Astro Awani. As usual, your superwomen of science are Professor Dr. Dato Adiba Kamuruzaman, Professor of Medicine and Infectious Diseases, University Malaya, and currently in a very important meeting, Tan Sri Dr. Jamila Mahmud, Special Advisor to the Prime Minister on Public Health. Dr. Jim asked us to hold the fort for her. She's in a very important meeting at this moment. She will join us when she can, but today's topic is going to be on a rather unpopular subject and something which may make you lose taste for that goreng pisang in your head. And the topic today is obesity. So very unfortunately for the country who loves her firsts and number one, Malaysia is the number one country in Southeast Asia when it comes to the prevalence of obesity in adults. In a report issued in February 2020, the WHO said obesity has reached epidemic proportions globally, with at least 2.8 million people dying each year as a result of being overweight or obese. And the figures are grim in Malaysia too. According to the World Population Review 2019, Malaysia has the highest prevalence of obesity among adults in Southeast Asia at 15.6%, followed by Brunei 14.1%, Thailand 10%, and Indonesia 6.9%. The National Health and Morbidity Survey 2019 findings, meanwhile, showed that 50.1% of adults in Malaysia were either overweight or obese. That's 30.4% overweight, 19.7% obese. A real bitter pill to swallow, don't you think, Prof?
Absolutely. And, I think one of the reasons we, Tan Sri Jamila, Karen, yourselves, and I wanted to follow up on this with this topic today after the last week's topic where we had Prof. Lim talk about diabetes, because in a way they go hand in hand. And the link with COVID is indisputable in terms of people who have diabetes, people who are obese are at a much, much higher risk of getting severe disease and dying. And both our guest today, Dr. Masni, and I, unfortunately have the first-hand experience of managing, this situation right now. And like what I said, before we came online, COVID, in a way, inshallah, will go away, or we have to learn to live with it. But we can do so much more to address this other epidemic of obesity, which leads to all kinds of health problems. So we're very, very grateful to have Dr. Masni as our guest today, who has dedicated her career in endocrinology to addressing this problem. There's not a lot of people, considering that half the population is overweight. We don't have enough specialists dealing with this. Yeah, Dr. Masni?
Yeah, it's nothing to celebrate. Being the heaviest nation in Southeast Asia, obesity goes way beyond a person being just overweight. Obesity is serious because it's associated with poor mental health outcomes, reduced quality of life. It's also associated with the leading causes of death worldwide because of its correlation with diabetes, heart disease, stroke, and some kinds of cancer. And this is why we decided to speak on this issue today. And Dr. Masni Muhammad, consultant endocrinologist from Hospital Putrajaya, has just told us as she was coming into the show that she has been forced to be in charge of the COVID wards in the hospital where she works, simply because there aren't enough doctors to go around. Hospital Putrajaya is going to be overwhelmed. The specialist centers are overwhelmed. And so it's left to the endocrinologists to take care of people who are suffering from COVID, and many of them who suffer from the serious comorbidities. So thanks for being on the show today, Dr. Masni. Can you tell us something about what you do as an endocrinologist and how you assist people struggling with obesity?
Assalamualaikum to Prof. Adiba, Karen.
Salam.
Salam Satu Malaysia. Thank you. I'm honored to be here with all of you and with the viewers. Before I proceed, let me introduce what is endocrinology. Endocrinology means disease related to hormones. Okay, our body ada more than hundreds of hormones. Yeah, our body. So disease related to hormones that's my specialty, endocrinology. So such as contoh-contoh penyakit endocrine ni, diabetes because of insufficient of insulin hormone, yeah, thyroid hormone like hypo or hyperthyroid, that's under endocrine. So, over cortisol or under cortisol, so those are contoh-contoh penyakit endocrine, yeah. So what obesity got to do with endocrine ni? Okay, reason being because obesity, complications of obesity ni such as diabetes, such as hypertension, dyslipidemia, and others are related banyak endocrine manage. So in the end, endocrinologists ni have to champion the obesity. Okay, on top of that, about 5 to 10% of the causes of obesity ni disebabkan oleh penyakit endocrine. So such as hypothyroid, Cushing's disease. So that's the reason why endocrinologists have to champion this obesity lah, yeah. Right. So that's how we come into the picture lah, Karen.
Okay.
But I can proceed why, but at the same time, not all endocrine wants to do obesity. I'm sort of like given the task to do this since 2004, 2005. Task to manage obesity, so we set up the obesity clinic there in Hospital Putrajaya. So and then set up the support group subsequently, and then what multidisciplinary clinic with the surgeon, with the ENT, etc. So it has become a well obesity clinic now lah. Yeah. Okay, a long way to go. We have gone a long way. Okay.
Well, you've come a long way, and we're very, very glad to have specialists like you championing a very, very great need in our nation. To start off the show, Dr. Mazni, can you please help define obesity?
Obesity defined as excess body fat in a body in relation to your lean mass. Okay, so lean mass is such as your bone, your muscle. So excess body fat or tissue, adipose tissue. Okay, so this excess is accessory. This excess of body fat cause more problem to us, to your body. Yeah. So how to define this? That's definition of obesity. So the better way of to define it by using calculation. The best way, standardized worldwide, is by calculating your body mass index. Yeah? So that's the standardized way. Not the best, but that's the least. That's the easiest way of doing. Besides than BMI. They also use waist circumference to define you whether you are obese, abdominal obesity or not obese. Yeah.
All right. So
how to calculate BMI?
You're doing great. So in the past decade, we've seen revisions in the food pyramid, where more and more doctors and nutritionists are teaching the patients not to make carbohydrates the base of the food pyramid. Has there been any change in how doctors view BMI and obesity? I liked what you said when you said, BMI might not be the best way to calculate whether a person is obese, but it's certainly the way that doctors have used for a very long time. Has there been any change in what is considered normal in BMI? Is 18.5 to 24.9 still considered normal? 22 to 29.9 overweight and obesity classified as a BMI of 30 and above?
There are two questions there. So about the food pyramid and also about the BMI. So food pyramid recently, that was to 2020, they launched a new food pyramid. After quite some time, they haven't renewed the food pyramid, which it's high time to renew the food pyramid. So it was tough to me to tell my patient you need to cut down your carbs, but at the same time our food pyramid tells otherwise, right? Okay, so the old food pyramid tells carbohydrate is our the baseline of the food pyramid. It has to be about 6 to 7 servings per day. But when I tell my patient we have to reduce the portion, we have to cut down, reduce the calorie, reduce the carbs, but that's how it was difficult for us to counteract that food pyramid. But it's good. They've changed it where the fiber is at the baseline of the food pyramid. Fiber and fruits and vegetables. It's good to have that as a baseline because fiber, vegetables and fruits are high in fiber, high in vitamins, high in minerals, and lots of phytochemicals there, which has antioxidant, anti-inflammatory. So study has multiple times done to show that fiber reduce satiety, fiber reduce satiety, reduce the food intake. Fiber reduce the incidence of diabetes also. So that helps, yeah, with the high fiber. So, but not easy to have 5 servings of all these fruits and veggie per day. Yeah, not easy to get that, but that's the way forward. That is the way forward. And second food pyramid is a carbohydrate. Should be the second. We need that as an energy, but not lots of it. Yeah. Third will be protein. We need the protein, yeah, because of our muscle daily activity. But the least of most in our food pyramid, try to reduce your fat, which is from the oil, yeah, from the oil, all those fried food. Reduce the sugar, the refined sugar, and also and the salt. Yeah, that's the least thing that you should cut it down. Right. So that's the food pyramid which we should follow. That's the latest thing. Right. Second is about BMI. BMI that you were talking about, the 50.1% overweight and obesity is using the Caucasian punya cut-off, Karen. Caucasian punya cut-off. We Malaysian, Asian, it has a lower BMI cut-off sebenarnya. Okay?
Oh my goodness.
That lower, okay. That lower cut-off is needed because the study 20 years already, study has proven multiple times that we Asian are at higher risk of getting diabetes, cardiovascular, dyslipidemia, hypertension, at high risk of getting this at lower BMI. Multiple study, big study already have proven. So Malaysia has reduced that cut-off already in Malaysia. So our cut-off for normal BMI, normal weight is 18.9 to 23. So that's normal. That's normal. 23 to 27.4 is overweight. 27.4 to 35 is obesity class 1. 35 to 40 is class 2. More than 40 is class 3. BMI more than 50 is, we call it super obese, right? Okay, so we have to reduce that BMI cutoff because of that we are higher risk. Okay, not only that, the BMI cutoff, we also reduce the waist circumference cutoff. For female, it should be less than 80 centimeter. For male, it should be less than 90 centimeter. Why? Similar, because we are higher risk at lower waist circumference, at lower BMI. Higher risk, if let's say we put it up higher, lagi double the risk. Okay, we have to reduce the risk.
Alamak, Dr. Masni, kalau macam ni ya, aku tak payah makan makanan malam lah. Breakfast pun tak payah makan lah.
Yeah, so I'm telling the viewers.
Has Dr. Masni scared you enough, Karen?
Alamak, teruk ni. Dah bergetar ni. This is scary. I never knew this, Dr. Masni. How come none of my endocrinologists have ever said that there was an Asian BMI scale compared to an international BMI scale?
That our CPG is 2004. Dah lama dah. It's already there already. It's already there. So, but the reason why they have to use that BMI cutoff, because they want to compare with the other countries. That's the reason they want to compare how bad we are, to compare you as a comparable. Even using that BMI, we are still the highest. We're still the fattest. Kalau use lagi lower lagi lah, right?
This is terrifying. Okay. This is terrifying.
Okay.
I mean, give us a little more perspective on the prevalence of obesity. Can you tell me of the patients you see? You know, because endocrinologists don't just deal with obesity, they deal with a multifactorial, multi-bundle of hormonal issues. What percentage is obese of the patients that you see? And being obese, How many suffer from other bundled illnesses?
The prevalence of obesity kalau worldwide is huge. Overweight itself is nearly about 2 billion worldwide. Kalau obese is nearly more than 100 million are obese. Actually, it's more than 100. Okay, so that's worldwide. Malaysia, you mentioned it just now, overweight plus obesity is about 50.1. But if I use the lower BMI cut-off for Malaysian cut-off, it's about 60.1%, 60-something%. Right, so at actually not 1 in 2 anymore, it's more than 1. So 1 in 0.0 are obese or overweight. If you walk at the mall, well, we can't walk at the moment. We walk at the mall, 1 will be normal weight, 1 will be obese or overweight. Yeah, so that's a simple way of looking at it if you go out. Yeah. Okay, so that's the prevalence of obesity. So obesity, why is it so important? It's the root of the problem, root cause of all the non-communicable disease. Root of the problem for diabetes is the highest. So for someone who's obese, to get diabetes 6 times, nearly about 600 times to get diabetes. Yeah, 6 times higher, the odd ratio. Okay, 6 times higher untuk dapat diabetes. The second will be hypertension, dyslipidemia, and others. Okay, so simply put, if you want to see, memang banyak bundle. It comes with all multiple comorbidities or complication. So I put it simple way for the viewers to see from head to toe. Head to toe, semua organ will be involved, will be affected by obesity. Simple way of putting it aja. Okay, from the head, so you high risk untuk dapat stroke, benign intracranial hypertension, go down a bit to the neck, you get breathing problem because of obstructive sleep apnea, ya, yang tidur berdengkur waktu malam tu, early morning akan sakit kepala, daytime somnolence, itu sleep apnea. So usually kalau paper je tulis micro sleep, actually it's obstructive sleep apnea. Lower, and because of that sleep apnea, you get pulmonary hypertension, not hypertension kat sini, lung hypertension. Heart disease, yeah, all those multiple heart disease, the dilated punya lah, ischemic heart disease, go down to your liver, high risk to get fatty liver, or they call it non-alcoholic fatty liver. Fatty liver is not a silent disease. It can lead to cirrhosis and lead to hepatocellular cancer. So go down to the bowel and to the joint, all those mechanical problem. Mechanical such as GERD, reflux, yeah, reflux, okay. You can get for ladies, incontinence, stress urinary incontinence, UV prolapse. Men also get urinary incontinence. Other mechanical, joint problem, prolapse disc, hip osteoarthritis, knee osteoarthritis. Okay, not to mention the metabolic, diabetes, hypertension, dyslipidemia. Okay, vein thrombosis, high risk untuk dapat varicose vein, and veins will be blocked. Once blocked, deep vein thrombosis. Yeah, all right. So those that are to mention a few. Oh, not to mention last but not least, cancer risk, something that usually ramai orang overlook, obesity and cancer. Ladies, because it's the highest cancer related to obesity is endometrial cancer. Ladies, look out for it, right? Endometrial cancer, yeah. Second, then others, ovarian and postmenopausal breast cancer. So cancer that related to men and women, renal cancer, liver cancer, gallbladder cancer, blood cancer. So those are high risk, yeah. Okay, right. They're high risk. Okay. So have I covered? Right. Okay. Back to you.
That's scary. Yeah, that is really, really scary. I'm a little bit lost for words at the moment, Dr. Mazli. It's terrifying, you know. Can you share with our viewers, Dr. Mazli, just why medical professionals are so worried about people with obesity contracting COVID?
COVID, as I mentioned, associated with multiple other comorbidities, complication. They can get diabetes, they can get heart disease. Okay, but not all of them have all those tiga serangkai. Okay, the diabetes, hypertension, and heart disease. So they may have obesity and diabetes or hypertension only. But once being obese per se put you on the already immune system down already. Okay, the immune system already on the downside. Okay, so bila kena COVID, so you punya virus entry tu lagi banyak viral load tu sebab apa? Dia ada receptor dekat adipose cell untuk dapat that virus. Okay, that make it worse. Okay, satu. So kalau ada diabetic, like immune system dan being obese, immune system lagi down, so lagi florid. So akan dapat cytokine storm lah, ARDS, acute respiratory distress syndrome. Okay, so ventilation will be difficult because they are huge. So nak masuk intubation will be difficult. So they are high risk untuk dapat thrombosis also, salur darah tersumbat. PE, pulmonary embolism, high risk. So to manage your diabetes lagi lah. So banyak sangat complication COVID and obesity. COVID and obesity is not a good combination. So those yang overweight and obese, you must try to avoid getting COVID, yeah, because you will get severe. Studies daripada US showed ramai yang masuk ICU in those yang obese, BMI yang 40, ramai yang masuk ICU. Mortality is higher after age. Orang berumur memang lagi higher mortality, kematian. Second kadar kematian adalah obesity. Second after age, yeah. Right, they are high risk untuk kena intubation juga. The fourth thing that they found out in US, they have prolonged hospitalization from COVID juga. That's what they found out lah. So it's not a good combo. Try to avoid COVID, yeah.
All right. Are you going to scare me again more, Professor Adila?
I'm telling
yes,
you.
Yes, I will, Karen. Maybe I will. I think Dr. Mazni has done a good job of scaring you, but let me add with some figures from the UK. Yeah? That study, we spoke a lot about BMI. So the Public Health England organization has estimated that kalau BMI is more than between 35 to 40, you have an increased chance of dying from COVID by 40%. 40? 40. Okay, and if you have a BMI of greater than 40, of course, these are very large people, you have an increased chance of dying by 90%. So for all those reasons that Dr. Masni just explained, but basically because with fat cells, you have increase in circulating cytokines. So I think we discussed this a bit last week that, together with diabetes, when you have COVID, unfortunately, the immune system cannot shut off as well as it should in people who don't have diabetes, who are not obese. So in that second week of illness, you have an reaction of the immune system, and that's the cytokine storm that Dr. Masdi mentioned, that people then have the severe pneumonia and other organ damage that we see. On top of that, because you're large, you don't have the lung reserve, not only physically more difficult to intubate you and ventilate you, but you have the poor lung reserve, and years of obesity can make people have obstructive sleep apnea, therefore their heart is weakened, etc. So and what Dr. Masni explained is there's certain hormones and certain proteins in the body that also get affected by obesity that directly interacts with the virus itself. So these are the problems that we face, and Dr. Masni has outlined the many non-communicable disease complications as a result of obesity. We've just, in terms of infectious disease, COVID-19 is the obvious one, but dengue also, severe dengue is also seen in people who are obese. So in terms of what to do now, yes, avoid, putting yourself at risk of COVID-19, but if you are overweight, try and get yourself vaccinated as soon as possible. It doesn't matter if you are not aged over 60, if you have a BMI that puts you in the overweight category, I think you have a good justification, even if you're 20 years old, 30 years old, especially if you're a male, because that's added risk for severe COVID, to go and get yourself vaccinated as soon as possible.
Professor Adiba, why is it an increased risk if you are male and obese for you to get complications from COVID?
So the male gender on its own increases the risk of getting severe COVID. And again, it's in relation to hormones, as well as those cytokines, the immune system. The immune system works a little bit more in favor for women than for men.
All right. Well, thank you for my monthly period. You know, that's all I can say. So, Professor Adiba, you've always been my source for on-the-ground COVID situations. Can I ask what percentage of the patients you see in PPUM's COVID ward is obese, and do they truly need more care?
Yeah, I must apologize. We've not been able to really crunch the numbers to give you an accurate figure. But put it simplistically, for those who are less than 60, I mean, you know, we know that age is a clear risk factor for severe COVID. But if you're less than 60, all those things that we mentioned before, including obesity, is definitely a risk factor. And we see it in much younger people. They can deteriorate very quickly. We've just had someone who's just come out of ICU who, you know, is only in his mid to late 20s, but is overweight. So it's a real problem, yeah. And I think you know, the high rates of death in the US has also been attributed to the big numbers of obese patients they have over there.
Dr. Masu, you also take care of COVID patients in Putrajaya. Can you tell us a little bit about your experiences in the COVID ward, and especially when it pertains to people with obesity?
Not the wards. I'm taking care of the ICU COVID. So the wards are taken care by another endocrinologist. Once they are there, they have, yes, of course, the setting, the ventilation is difficult. Yeah, the sugar, if that's because one of the treatment is we have to give metipred and dexamethasone. So that make worse of their glucose control if they have diabetes or may have glucose intolerance in ICU. So the sugar control will be tough. Ventilation it definitely will be difficult. I don't know how to say it for to extubate. As I say, it's just difficult to win down the ventilation. They will get a lot of complications from COVID itself, high risk from ARDS, acute respiratory distress syndrome, and higher risk of getting quite a number of them getting organizing pneumonia. So the complications from COVID itself. So and tough to win down their ventilation. It's not easy. It's not easy managing them.
So the risks we're trying to get across is this: COVID-19 poses a much greater health risk to an obese patient than a patient with normal body weight. It's difficult in these overly woke times where everything is looked at as an attack or as being disparaging to a certain subset of the populace, to underscore that doctors will, and they do, treat all people needing medical assistance the same way. However, these same doctors are also here to tell you that being obese is a strain not only in a patient's body, joints, and endocrine system, but also on patients' families and the medical teams who treat them. This is speaking directly to our audiences. I was 103 kilos when I gave birth to my child. It took 3 nurses to lift me from gurney to the operating table. And I heard the anesthetist say, "I'm sorry, I'm asking this again from you, my girls." So obviously I wasn't the first fat patient that they had seen being put on the OT, you know? And I realized then and there that my that obesity wasn't just my issue, it was a problem for others as well. So, Dr. Masni, just so people understand what it means to have COVID when a person is obese, can you paint in very stark terms what it would feel like for an obese patient with COVID?
From what sense of view? Let's say when you mentioned just now about the staff that Allied Health affected, yes, it's not easy to turn them. That they have to be prone, and they have to be prone at certain how many hours. So they need few hands, to help them to turn. They need bigger tables, bigger tables, But other apparatus point of view, if let's say if they are well, to help them to use use the bedpan, they need help in a lot of things. But that cause issue to the healthcare workers. The healthcare will get complications from this carrying all this. They can get quite a number of them have back pain, because of doing all this extra. They have to carry the extra weight load, right, workload, right. Did that answer the questions? No?
Yes, it does. I would also imagine that just the day-to-day care of a person with COVID is difficult, because like if you are suffering from another disease in a very different time, you would have some family who would help you sponge bathe, or to feed you, or or to wash up, brush your teeth. But here in a COVID ward where a patient is completely isolated, they're completely dependent on the help that they get from the medical staffers, correct? And with our medical staff and our frontliners being so stretched and so tired, I can just imagine how it would hurt somebody who's already working, a 3-shift on, having to again try to change, to wipe down a patient, a very, very heavy, morbidly obese patient, right? I can't, it feels very, very dark, and it feels very bleak. What about breathing complications? You spoke about an acute respiratory syndromes, and how we don't have enough lung mass for obese people. How bad can COVID affect somebody's respiratory system, Dr. Masli, if you're obese?
Their immune system are already down, so they tend to get more viral load, right? Because of the adipose cell, and in the lung they have that ACE receptor. Okay, so if if baseline already before COVID, they already have pulmonary obstructive sleep apnea, their CO2 carbon dioxide are already on the high side. So they may have mild pulmonary hypertension, may not have mild pulmonary hypertension, but they tend to be higher risk of getting hypoxia, meaning oxygen will be lower, and they are happy. They don't have that much symptoms. Okay, so that's just, okay, once they get COVID infection, they get severe. Okay, hypoxia will become immediate, well, sort of like very fast. They get symptoms very fast. The oxygen will be down very fast. Carbon dioxide will go up very fast because of the underlying obstructive sleep apnea in an obese person. Okay, so that's number one. That's the start off. So if let's say the oxygen is really low and doctors have to intubate them, so intubation will not be easy in an obese person. They have difficult intubation is well known in an obese patient. So they have to use boogies, or it will be, so that will cause more injury to the obese person, obese patient. Okay, so I was mentioned earlier by Prof. Adiba, because of that, their body habitus itself, that will cause their capacity, lung capacity is reduced. The lung capacity is reduced, so they will, so oxygen will be much lower in these people. The full lung capacity is definitely lower. So that make worse when they are being intubated. Okay, higher risk, because then second, the immune system is down, higher risk to get the cytokine storm, the respiratory ARDS, respiratory distress syndrome, and then at the same time high risk of getting organizing pneumonia. So that is from the lung point of view, lung point of view. Okay.
Okay, so we have our loyal viewers tuning in today. Thank you so much, Zarina Abdul Aziz. You've spoken about the pandemic being a year long, and many have gained weight. That's so true. You also speak about missing exercise and missing Zumba. Let's move on to a little bit of what we can do as opposed to what we cannot do. So, Prof. Adiba, what would you recommend for someone who is trying to lose weight? How do we battle this obesity crisis one person at a time?
Yeah, I think this is really Dr. Masni's area of specialty, so I will let her speak. But I'll just very quickly say that in this era of staying home, there's been certain things that happen to different people. Some people go to cooking and have been baking and cooking more sweet things and cakes. So there's been an increased risk to becoming overweight. Second, because we're more sedentary, but many are working from home, and so that increases the risk further. But on the other hand, I think there are also parts of the population who become more aware and have actually gone out to exercise and doing, Zoom yoga, Zoom exercise and all that. So our job today is, I think, to convince people that obesity is bad news, but there are things that can be done. So I will hand over to Dr. Masni, who really is the expert in this topic. Yeah.
How to prevent this during this pandemic, the obesity pandemic, and we are having COVID pandemic at the same time. Working from home has its pros and cons. Yeah? So one of the pros is few of my patients said, and even my sister, she's happy that she's not stuck in a jam. So she's happy to work from home. But at the same time, when you're stuck at home, your only exercise is from the lounge to the kitchen. Lounge kitchen, itu je exercise you all kan, right? But there are other ways of doing this. Increase your activity. So, but before I talk about physical activity, kita cakap tentang makanan first. Okay, so this is the time when you're at home, try to cook healthy food, healthy. And then kalau you dah masak healthy tu, try to tak kena masak selalu. I know it's work from home, sometimes it can be taxing. Mana nak jaga PDPR anak-anak you all, yeah, okay. So, but use this time untuk bukan baking, masak healthy food untuk family, right? Healthy food meaning yang tak banyak oil, low salt, low fat, and less sugar, okay? So, portion control, quarter half, use that concept of quarter half, plate method, yeah? Quarter to carbo, quarter to protein, and the half will be your veggie and also fruits. Okay, use that concept, implement in your family. So the whole family are most of the time at home now. Okay, use that time as a quality time untuk buat benda-benda macam tu. Okay, satu. So that's try to avoid, which is not easy said than done. All those online food, yeah, trendy foods that you can get online. Okay, beli all those juicy, all those high dense calorie food. Try avoid. All this trendy food, yang high processed food are high in calorie. Bendanya sikit, tapi kalori banyak, ya, dengan sugarnya, dengan saltnya, dengan fatnya. Avoid all those trendy foods yang you beli semuanya online. Yes, sometimes can be cheap, sometimes can be expensive, but it's not worth it when it comes to your collection. Banyak makin tambah body fat nanti. Okay, alright. Okay, so let us move on to the exercise. So not just exercise dekat lounge to the kitchen, do a bit gardening, walk a bit extra, open up your online exercise. Banyak free online exercise. Yes, memang tak boleh pergi dah gym because that tak ikut SOP. Kita kena buat semua tu kena tutup. Online exercise such as what I've been telling my patients untuk buka, I kata now buka your YouTube, now tekan Tabata for beginners. Tabata, oh doktor, Tabata ni very hard regime. No, do whatever you can. You boleh angkat separuh jalan je kaki, angkat je separuh jalan. If once you buat selalu hari-hari, later on dah jadi 45 degree, later on jadi 95 degree. All right, do it. Do whatever minimal things that you can do. So start off with 10 minutes morning, 10 minutes in the evening. Later on, increase after 1 week, increase. So that's how use that time during masa time ni untuk prevent. The most important is prevent weight gain. Kalau dapat lose weight, oh, that is a bonus. That is a bonus for you. You should reward yourself lah. Reward beli baju baru lah. Jangan reward dengan makan pula. Okay? Jangan reward makan. Okay, reward dengan beli baju baru. But once you dapat lose weight, try to reward yourself. That's good, certifying that you are doing something about it. But most important for now, what I can tell viewers, try to prevent weight gain. Prevent first. Then you can prevent. Then after that, go one step further. Try to lose weight. That's simple things. Food and also exercise. Yeah. Okay.
All right. Thank you, Dr. Mas. That makes sense. I mean, but this has been every GP, every family doctor, every endocrine specialist, war cry. It's been this way for the past 20, 30 years already, but things are still not changing. But well, the great news is that we do have a game changer with us. Tan Sri Jamila Mahmud has joined the chat, fresh off the meetings. Welcome, Tan Sri. Thank you for being with us.
Assalamualaikum, salam sejahtera. Sorry everyone, I had a very important meeting I couldn't get out of.
Tak apa, we're glad that you're here. How have you been?
Dr. Masni and Prof. Adiba and Karen.
It's good to see you. All right, Dr. Masni, the Star recently ran an article saying that Malaysia expects a 3-fold increase in obese children because of this pandemic. Does this surprise you?
No, definitely no. 5 years ago, during the National Health Mobility Survey, it was 1 in 6 of our children aged 5 to 17 years. That's the percentage. 1 in 6 our children are overweight and obese. So the latest NHMS 2019, 1 in 4 our children are overweight and obese, like combine both, 29%. So actually, it's about 1 in 4. So 80% of these obese children and adolescents, 80% of them will progress into adult obesity, 30% of them. So we have to intervene at school level itself. Children obesity is a real thing, and they will progress into adult obese adult.
Would you say that this would be a powerful course, that an obese child would always become an obese adult?
80% of them. If we can intervene, that can be reduced. We have to intervene early. So MOE have to go hand in hand with KKM. It's not just KKM alone.
But what are we missing in this battle against obesity? Because we've heard the same rallying cry over the years. I've heard it, my mother has heard it, and I hear it now as a mother as well. We know about the factors contributing to obesity, food, lack of physical exercise, the environment. Sometimes people blame genetics, but genetics don't really play a huge part in the obesity pandemic that we're facing right now. If somebody's going to tell me that this is because of your hormones, that's really, unless you have an endocrinologist telling you that your hormones are bing bong, you don't have an endocrinological issue for losing weight. A lot of it is just your food intake, your physical intake, right? What should we be doing better, Dr. Masni, in telling people how to fight obesity?
It's not just food, Karen. It's food, physical activity, but our environment, our external factors make it hard for our overweight and obese person to lose weight. Our environment as overall, so that make it difficult. They need support. They need support from their family, from their friends. They need the external support, the external factors such as, if they keep on giving from the iklan, tunjukkan all those makanan, all this food, they will get distracted. They will get enticed, right? So we have to cut down all those iklan. Okay, beside than that, the 24 hours kedai restoran, kedai makan, we have to do something about it. But pernah kementerian cuba buat, habis tak bagi tutup 24 hours ni, pernah, yeah, they want to they want to tutupkan. Besides that, ada lagi easily accessible healthy food. The external factor ni kena sama-sama tolong lah. It is not easy for you alone to fight. You have to understand. It's not easy to fight alone. We have to help our obese friend, our overweight jiran. So we have to help them because factor ni lah kita kena tolong. It's not just food and also exercise. I don't blame itu aja 100%. Genetic play a small role, yes, true. Factor luaran ni yang kita kena sama-sama tolong, right?
Yeah.
I just want, oh sorry, Adiba.
No, go ahead.
No, I just want to say you just took the words out of my mouth. As someone who has a struggling weight problem all the time, it doesn't help when food is number one, so accessible, and number two, it takes discipline, and many of us, I can speak for myself, and it's not so disciplined. So the other way is actually creating the environment at home as well that will support you, right? If, for example, you are trying very hard and then your husband walks in with food, then you have no choice but to eat it. And this this 24-hour nasi lemak business, it's just not good. I think, how do you retrain the whole society on good dietary habits? And I think it must begin from school. It must begin from home and from school.
It's not only that, it's
that is so true.
Yeah, and I think unfortunately all these things require a lot of political will, because in the end, what will need to happen is legislation, whether it's closing down the mamak stores earlier, and not have it open 24 hours a day, increasing the taxation on rice or sweet drinks and all those things that we know are associated with obesity and diabetes. And then, of course, but a real problem is also, I think, in the lower socioeconomic sector of our society. Unfortunately, nutritious, not so nutritious food is more affordable. A mountain plate full of rice is lebih kenyang than just eating sayur and fish, which is more expensive. So it's, as Dr. Masmi said, it's multifactorial. It's not a simple problem to address, but it cannot be left to KTM alone. Ministry of Education, everyone needs to play their role.
Everyone has to play a role. Yes,
in the end, I think it will fall on the Ministry of Health, because the budget to deal with the complications of it is very
large. They have many policies, but policies is not easy to implement because of it involves other sector. So, but other sectors are not playing their role. So that's not easy. Kalau Ministry of Education, in Singapore, for example, they started sekarang ni dah buat for school goers. They start healthy food. The canteen mesti ada healthy food, mesti ada sayur. So they have they implemented token. Kalau pergi beli something good, dapat something rebate, right? So you can see now the obesity in their children obesity is like plateau lah. All this takes about 10 years. Kalau kita implement hari ni, 10 years baru nampak. So show a bit of plateau. Macam Australia juga. Dan nampak a bit of plateau. Okay, they implement, they start at their school goers. Yeah? They implemented at their sekolah lah. They have the activity, kena ada physical exercise in their school. Tahu. So they can see the outcome now. Tak apalah, bukan turun, tapi at least plateau. Bukan makin naik, right? The obesity, okay?
Yeah, it makes sense. Like very small changes, but over a very, very gradual period of time.
Karen, I think you know what, we need champions to actually move this along. I'm just thinking about Jamie Oliver in the UK, where he took on the school meal program, and he really made it his case, right, to say that, you know, children must be fed healthy food in schools. So we need that kind of movement. But yet, you know, at the same time, Dr. Masni, you know, and I'm sure Adiba said it spot on, because the less money you have, the chances are you buy food that fills you up cheaply, and that's usually cheap carbohydrates and processed food. Yet, you know, tons and tons of vegetables are thrown each day from supermarkets, from Cameron Highlands, from, you know, Pasar Borong. We don't have a system where we can actually recycle, you know, whether in UK, they call it the ugly vegetables, the one that may not look like the most shiny and glossy, that can be accessible cheap to the masses, or given to, you know, PPR and so forth. I know there are organizations like what's it called, Food for the Future or something. But anyway, there are some organizations that try to reduce the amount of vegetables going to the bin by making sure that they're given. I think we need this kind of movement here. We need the champions that will actually push this along.
Oh my goodness, I'm looking at her right now. I mean, considering Dr. Jen, you've given me produce from your own garden, that huge cucumber, the size of my forearm, grown without pesticides, only with natural fertilizer. I mean, there you are. That's another thing that you can add to your portfolio.
But I'm pretty lucky, Karen. I have enough land to grow my vegetables, right? So I'm very lucky. I stopped taking red meat as much as, you know, I cannot think when I ate red meat last, but the thing is that, you know, you make a conscious decision about your health, but, you know, we can make this affordable. I was judging a competition recently, and I was so excited because they won the prize. It was young people who designed a food system for example, low income flats and so forth, but also, you know, a system where people can actually watch and grow their own food. And, you know, how you educate children to say, okay, here's my kangkong, and I'm going to watch it every day as it grows, and then as it's harvested, it comes to me. But this is the kind of, it's a culture that you need to build into people's minds, and especially young people. So I think it's a major struggle, but we have to start.
Need a revolution.
Yes, we need a food revolution. We definitely do. Yeah, and it begins with the small people, you know, the cooks, the people who are passionate about cooking well. I think one of the biggest takebacks that we had about eating well on one of our prior sessions was when one of our listeners actually, or viewers actually, said to us, it does not have to be that cheap food is bad food. A bag of dal, a bag of lentils, a bag of pulses, you know, is fantastic nutrition. You have a protein source, you have a very low fat source. You know, it is amazing what you can do with a bag of dal. And dal fills you up. It gives you the fiber, which should be the base of your food pyramid. It can be made spicy. It can be made palatable. It keeps well. You know, it does so much for you than one bag of Maggi mee, kan? But it is, again, education.
Yeah. I have a question for you, Dr. Masni. What is your opinion on keto diet, intermittent fasting? Has it been asked? I don't know, but I'm just keen.
Keto diet is okay. Most of the diet that has been advocated are something that easy and doable for this obese and overweight person. So if they can do it, go ahead. Keto is mainly protein diet, but make sure it's a bit balanced. There's a bit of veggie there. Problem with keto diet, they can't sustain. They can't sustain because it's just that they want their carbs. They want their carbs. You can get carbs craving. Okay, they can't sustain. Number two with keto diet is that the only way of doing proteins, the only way of cooking method is frying. So their cholesterol, their lipids tend to be higher. Cholesterol tend to be higher at the end of the keto diet program, maybe 3 months. Right? So weight, yes, weight can be reduced. Yeah, weight definitely reduced. 5 to 10%, it means a lot. 5 to 10%, it still means a lot for me. It's fine, go, continue, but they can't sustain. And high cholesterol, okay, fine, that would be keto diet. Protein diet base itself, protein, a bit of carbs, that's go ahead. Intermittent fasting, there are many studies already. So I'm all for it also, but if you have disease like diabetes or kidney disease, I don't advocate intermittent fasting or keto diet. So they're slightly higher because they will produce ketones, and that ketone is beta butyric acid. So that put you on acidic, so higher risk of acidosis. So for diabetes with kidney impairment or with mild CKD, so that's not advisable at all. Okay, but diabetes with no other disease, not many small study only. So usually I do IF for my patient. So I monitor them. I will have to monitor. The IF that I advocate intermittent fasting, IF is intermittent fasting that I advocate for my patient is 16/8 or 18/6. Okay, so that is doable. Why is it doable? Person don't have to calculate their calorie. So once they don't have to calculate, they have restricted time, they won't eat. They will not eat that much with that restricted time. They're busy with things, so they will not eat. If they follow, it's something that they can do. And weight loss, yes, definitely, that's weight loss. So these are the few things that I advocate. Then go ahead. If they can do, go ahead. There are things that I've been telling my patients to do also. If they are for my patients, they are before going for bariatric surgery. I do offer bariatric surgery to my patients, but few selected patients are committed only. So they can do very low calorie diet, meaning very low, meaning 800 kilocalorie and below. So that's really low. That's really low. So I call that also a starvation diet. So they use meal replacement. So the meal replacement, so that they don't have to calculate meal replacement. So within 8 weeks prior to going for ops, so usually about 4 weeks to 8 weeks. So weight loss to reduce their complications before and after op, just mainly to reduce the complications. And that VLCD also I use for obese ladies who wants to get fertility treatment. In ops and gynae, they won't start any fertility treatment if they're obese, so because the risk is there. So once starting the very low calorie, lose weight at least 35 kilo, BMI of 35 and below. So then I send them back to their ops and gynae at least. So it can be done. It can be done with VLCD, and weight reduce a lot. The weight can reduce a lot with VLCD alone using meal replacement.
I'm all for you. I absolutely agree with what you're saying because I've tried all of those. VLCDs are great for like enthusiasm start. You know, it's great untuk pupuk semangat. When you are you tahan lapar, and minum 3 sachet satu hari aja, tapi you see the weight coming off, and you rasa macam okay, saya bangga diri, you know, I can do it, you know. But it's impossible to keep on with a VLCD, a very low calorie diet for so long, you know. It has to be followed up by something that changes in you, in the way you look at food, in your relationship with food. And I think one of the most important things that people don't get, people who are not overweight, who don't get, is the causal relationship between food and emotion. That's a very big part of what we are not addressing. You know, food scarcity as a child can also play out in overeating as an adult. But comfort feeding from childhood can also result in a very, very fat adult, you know, and I have to say I was proof of that. So it is multifactorial, and it's not just tak cukup setakat education saja. There has to be, it has to touch on the emotions, it has to touch on the psychology of a person as well.
Karen, did I hear you say that you were 103 kilos at one point?
Sorry, Adiba, you broke up. What was it?
Did I really hear you say that you were 103 kilos at one point?
Yes, I was. I've been heavy all my life. I've been, at one particular time in my life, I was morbidly obese. So, you know, go figure. I mean, morbidly obese. Yeah, by BMI, by American BMI standards. And yes, I have lost weight. I've lost weight multiple times in my life, but the weight has come back until I realized that it wasn't just about my portion control. It wasn't enough to be suku-suku setengah for me, because my emotions were suku-suku setengah, you know, and that was the part of it that was not being addressed. I had a wonderful endocrinologist, I had a wonderful nutritionist, dietitians, you know, personal trainers, but the main gist of it was a person's relationship with food. What are your food issues psychologically that stop you or sabotage you consistently into putting on all the weight that you put off for months of heavy training, HIIT training, you know, interval training, weightlifting, and you can just throw it away because something in your heart doesn't tally with your mind.
Thank you for sharing that very personal account.
It is. Okay. So just moving back to obesity and COVID, Dr. Jamila, one question I see a lot on the vaccination discussion groups is why obesity is flagged as a concern for people looking to be vaccinated. You know, they always say, if you have these comorbidities, and obesity is right there. Can you explain this, please?
Yeah, I think Adiba can explain it even better than me, but just like hypertension, diabetes, obesity itself is a serious comorbidity. People who are obese, when they fall sick, it's about lung capacity as well, and about ventilation and all the complications that come from being morbidly obese. So maybe Adiba, you want to take it from here?
Yeah, no, I think we discussed that quite extensively with Dr. Masni.
You're breaking up, Adiba.
No, the rain is really heavy where I am. So we discussed this quite extensively at the beginning already about, you know, not just the mechanical problems to ventilate and to support people with COVID-19 who are obese, but also the underlying immune reaction. But I think there's confusion in people, just like they are very confused. Should people with diabetes be vaccinated? And the short, definite answer is yes. The short, definite answer to people who are obese to be vaccinated, like I said earlier, should be done as soon as possible, regardless of age, because of that high risk of severe disease. Yeah, Karen?
Yep, definitely. Okay. So I think we've had very, very positive responses to this session. My friends have been calling me and texting me and saying that, you know, Dr. Masni, you've been very, very kind about things that you've said, and the way you've approached this entire topic of obesity has been much more wholehearted than clinical, and they thank you for it specifically. But what people also want to know is it possible for somebody to change enough in the way they look at food so that they will have a better relationship with food? Does seeing an endocrinologist help you manage your emotions and your thinking process when it comes to food, Dr. Masni?
There's a condition called eating disorder. Yeah, eating disorder. So the few eating disorder that we've been recognized as a condition, such as binging. Yeah, binging when you're so stressed, you tend to overeat, and that you can't control yourself. You overeat, then once you finish, you notice, oh, you've eaten so much, and you feel guilty. So that's one of disorder, that's binging. The other eating disorder is nocturnal. You tend to eat at night. Yeah. So okay. The other thing is comfort. Food is not really a disorder, but we tend to find food when we are a bit stressed. Yeah, we relate. So it's good. I go because I won't talk about those eating disorder, because I will refer to behavior therapists and also psychologists for those person who have those kind of problems. So comfort food is more prominent, more common. Yeah. So when we stress, we find food. We want something sweet. We want chocolate. Those kind of thing. Yeah. Okay. So one thing that that's typical in ladies, but also I found that in some men also, yeah. So when you found how to detect this, do make a food diary. Once you have a food diary, okay, once you write down about your emotions and your food intake, what kind of food at the same time, how much, yeah. So once you have that diary, or you do it for about 1 or 2 months, 1 or 2 weeks, so you notice that, oh, you definitely have that issue. You have that issue, yeah. So how to tackle this is by doing behavior therapy. Okay, behavior therapy, stop yourself and you have this, how to overcome the stress, treat that stress first. Okay, so that stress, and then not to go to that food whenever you have that kind of situation again, yeah. Okay, so once you're able to avoid, reward yourself. So self-monitoring is very important. Self-monitor by measure yourself, by doing the food diary, okay, and reward yourself once you're able to overcome it. Not to reward, as I said earlier lah, not to reward with food. Reward with buy yourself some baju, okay? So you feel so good about yourself. So maybe reward yourself with some, if we can go out or do something else, okay? So that's how we should do it. But we need to identify first. Is it betul that we are having this issue? Okay, right? That is what you mentioned just now lah. How to relate the relationship with food, kan? Right?
Absolutely. Okay. So let's take a look at recovery from COVID for people with obesity now. You know, doctors, what should an obese person recovering from COVID be more cognizant about going forward?
Once recover, okay, kalau recovery ni, if they are category, depends on what category. Kalau they are on steroid and they are already overweight or obese, that will put them on slightly higher risk untuk weight gain. So my aim is, as long as they don't, I nak prevent their weight gain too, because that steroid will make them gain weight definitely because of complication from the COVID. Okay, so whatever category they are, as long as I nak prevent them from weight gain aja. Kalau dapat lose weight, oh, that is a bonus. Okay, so how to prevent this weight gain? Similar lah. So we have to start with food, exercise, yeah. Exercise, there are pharmacotherapy, ubat-ubat. So I jarang start ubat. Start with lifestyle first. So lifestyle, pemakanan, how to reduce the food portion ni, quarter half, meal replacement. You want to try intermittent fasting, which one suits you well? Because I tak boleh dictate, oh, you buat ni. No, what suits them well? Suits with their culture, suits with their lifestyle. Okay, so help guide them and tell them that, okay, this is maybe sesuai untuk you, guide them aja. Guide them and then increase the physical activity. Physical activity is very important sebenarnya. But dietary first, physical activity second. Okay, kena buat, right?
Okay, thank you, Dr. Masni. We have a little bit more time. Perhaps just before we wrap up, Dr. Jamila, could you give us an update on vaccinations and how things are going?
Thank you. Well, you would have seen over the weekend, we've managed to do 5,600 pregnant women in KL and 11,000 nationwide just this weekend, which is great. And we are going to receive more vaccines next month, very early next month. So that will take us forward in our vaccine rollout. You know, what has become very evident though, and I was looking at some data lately, that as the number of vaccine, and of course this is to be expected, the number of vaccinations have increased among the elderly population. In KL itself, 99% of those over 60 years of age have been vaccinated, and I think the figure for Selangor was 80-something%. But what we've seen is that the number of admissions to hospital in that age group has dropped. and it's the younger ones that are increased, partly because number one, they've not been fully vaccinated, but also they are the mobile ones, right? They're still moving around and going to work and all that. So we've really got to catch up on our vaccinations. People are registering, but we're now realizing that not everyone will register with My Sejahtera. So we're going out to people and then registering and vaccinating them at the same time. But there is still vaccine hesitancy, sadly. I was told just this afternoon that there was a mission that went out to Long Pasir in Sabah, and they were hoping to vaccinate 500 people, but 200 plus came forward. The rest didn't want a vaccine, which is quite sad. So, you know, we're still a long way to get people to understand the importance of vaccination. But elsewhere, you know, I've been on the road, Karen. So I've been in Kelantan, Terengganu, Pahang, you name it. I've been everywhere and talking to people on the ground and talking to the health centers. And it's quite reassuring. People now want the vaccine, but because the supply is not very high volume at the moment, so we have to pace the vaccine rate. But all I can say to our viewers is that come July, which is next week, we will be really ramping up, and I think that, you know, that's going to help us the minute we get. Of course, the other thing we worry about now is the Delta variant, which is in Malaysia, and Delta Plus, which has already started to emerge. Someone was saying that, you know, there'll be no more Greek alphabets left the way variants are popping up. But I think, you know, even then, what is evident is that you've seen the data in Israel and UK, even those countries that have been sort of herd immunity, they've been vaccinating quite a lot of their people, they're still getting breakthrough infections. But the good news is that they're not serious infections compared to if they had not been vaccinated. I think that's a very important message for us to convey to our friends and our family, that you must get vaccinated, because if you do catch it, then inshallah, you know, the disease won't be so serious, and that, you know, you don't need an admission to hospital, you don't need ICU admission. So we'll keep pushing. We will, you know, do our best to make sure we get to, you know, the percentages that we need. You would have seen the recovery plan has something which says 10% vaccination rate before you start opening up a little bit more, plus, you know, other things. But, you know, Adiba and I have been pushing this over and over again, ventilation guidelines and policies. And I think it's very, very scary the way Delta is spreading now. You know, even in open spaces, people passing each other seem to also be able to catch it. But I do know that we will be, I've seen now they're working on the ventilation guidelines, which is good, but we really need to move fast on that. I think the bottom line to everyone is, please, you know, make sure you ventilate your homes, your offices. If you're opening your mask to eat or talk, you know, talk away from each other rather than, you know, speaking and talking to each other. So, and then, you know, the testing must ramp up. And we've just had a meeting that I was late to coming here, and that, you know, pushing very hard, you know, for commitments for increased testing. And it's a whole, it's not just the vaccination, it's other things, you know, our care pathways and all that. So I'm really happy to know that pulse oximeters are now given out from the CAC, and the government has just approved to get more pulse oximeters out to people. So I think that we've just got to really embrace the fact that it's with us, this virus, and we've got to learn how to, you know, monitor ourselves, you know, make sure that, you know, we are taking all the precautions and the vaccines. But I think the longer term discussion on COVID-19 is going to be interesting. My bet is that, you know, we may be leading into endemicity. So, you know, there could be a need for annual vaccines or something, but we're not there yet. I think we're still trying to get out of this terrible situation we're in right now.
All right. Thank you, Dr. Jian. Dr. Masli, as we're wrapping up now, would you like to end the session with a wrap up of your observations and some advice, please?
Okay. Just two things that need to be highlighted. To prevent from getting the COVID, get yourself vaccinated. So that's a prevention. So do whatever the KKM SOP, okay? Get vaccinated. Number two is, regards to obesity, gaining weight is tough, yeah, so because of work from home. So try to prevent weight gain, right? Try to prevent. So the lifestyle measures I mentioned just now, try to implement. That's my take-home message. Right?
All right.
Okay.
Thank you, Dr. Mazni. Your thoughts, Professor Adiba?
Yeah, because just to follow on what Dr. Masni said, especially for us ladies, gaining weight is so easy. I think I just look at pisang goreng and I also put on weight, and I love pisang goreng. But losing weight is very, very hard. Putting on 2 kilos is so much easier than losing 2 kilos. But the consequences can be terrible. And so, we have to do all we can, not just for ourselves, but for our families that we are responsible for, to eat sensibly and to exercise frequently.
All right. Dr. Jamila, any closing thoughts on obesity and COVID?
Yeah, I think, we deliberately chose this topic and got a wonderful, wonderful guest speaker because obesity is not just a terrible condition to have, but it's also extremely difficult to manage, right? And we've heard all the explanations from psychological to, physical to lack of discipline to poor food choices and so forth. And I think that, in relation to COVID, we've seen that, those who are obese tend to get very much more severe disease and outcomes. So this is why, this topic has been chosen today. But beyond COVID, as Dr. Masni has said to us, 1 in 6 children are obese. Am I right in my? And then the latest.
1 in 4.
And then the latest data is 1 in 4. It was 1 in 6, and it's become 1 in 4, and that's an alarming figure, right? I think this is something we have to be very worried about. But obesity is never alone. It's always paired with something else: diabetes, hypertension, hypercholesterolemia, back problems, knee problems, you name it, right? So it's a vicious circle. So I think that so my hope is that all of us can be champions to have better diets. I'm certainly going to book an appointment to see Dr. Masni. And I think that, this has been a really enlightening session as well. So thank you so much, Dr. Masni, for being here with us.
My pleasure.
And it's a wrap. Thank you, Dr. Masni, for your time and your insights. This has been Censored Science, your weekly voice of science and reason with heart. Thank you, Pusat Perubatan Naluri, for making this series possible, and Astro Awani for carrying it to the masses. Have a good week ahead, Malaysia. This is Karen Michaela Tan, reminding you to be kind always. See you next week. Bye.